Moving to another important topic, which is actually Pachyonychia congenita. Let's start. Bismillahirrahmanirrahim. Number one, it has two types. Number one is the Jadasohan Lewandowski. The another is the Jackson Lawler type 2. Okay, the oral lesions you will see in the type 1. Okay, then it is a rare autosomal dominant genodermatosis, like it was the hereditary benign intraepithelium dyskeratosis. It was basically specific mutations in either keratin 6A or 16 gene, which can be seen in the type 1. Very important, in your MCQs they can ask you then that the MCQ can become in that type 1 Lewandowski, which keratin or which gene was involved in which the mutation has been happened. So it is 6A or either it is 16, but mutation in the 6B or keratin 17 is for type 2. Always remember it, very important. Clinical features of this is very important. Number one, remember nail changes. Okay, when basically mother give the birth to this child, so all the patients in their early neonatal period have the nail changes at the birth. Okay, or in their early neonatal period or at their birth, these all patients has the nail changes. Very important point. The free margins of nails are lifted up, so accumulation of keratinous material in all the nail beds resulting in the punched tubular configuration. Number one point, nail changes are present. How nail changes are present? The free margins of the nails are lifted up due to the accumulation of the keratinous material in the nail beds, and there are punched tubular configuration. Very important. Marked hyperkeratosis in the palms and soles. So you have a thick callus like lesions. Number one, nail changes were present. How? A punched tubular configuration is there, and then thick callus like lesions due to the excessive keratin deposition on the palms and soles. Okay, then hyperhidrosis of palm and soles means there is an excessive sweating of the palms and soles. Okay, punch uh, punctured papules on skin due to the abnormal accumulation of the keratin on the hair follicles. So there are punctured papules on the skin, very important also. Okay, formation of painful blasters on soles after a few minutes of walking during. So number one, changes nail changes were present there. Number two, there were actually a punch tubular configuration was present. Then there was excessive keratinization accumulation on soles and palms, hyperhidrosis on palm and soles, punch out papules on skin, and also because of their excessive accumulation of keratin in the hair follicles, painful blasters after a few minutes walking during the summers. The oral lesions are thick white plaques like we have studied before. Then there were the lateral margins and on the lateral margins and dorsal of the tongue. Other sites like mild trauma such as palate can, buccal mucosa, alveolar mucosa can also be involved. You can see there is excessive keratinization on the palms and soles. Okay, the tongue is also involved. The nails, punched, pinched tubular configuration is present. Hyperparakeratosis, agnatosis, and paranuclear clearing of cytoplasm cells, very important. If someone have asked you what is paranuclear clearing of the epithelium cells, means that the means in so there is actually clearing around the in the nucleus of the cells, but it is a histopathological feature of the Pachyonychia congenita. Okay, it is benign, no treatment. Nails are often lost or surgically removed. Okay, removal of excessive keratin from palms and soles, consoling the patient. Genetic counseling for the future family planning is very important. Okay, prenatal diagnosis is done by evaluating the material obtained from the chronis vallis and sampling using a molecular technique. It is very important how you diagnose the prenatal for the Pachyonychia congenita. It is like you obtain some material from the chronis vallis by using the molecular techniques. Okay.